Will exercise make your arthritic joint wear out faster? Or can exercise actually make the arthritis better? Most people assume that exercise is making their arthritis worse, but what the evidence shows is actually the opposite. I get asked this question quite often: can I continue exercising? Can I keep doing the things that I want to do? And the answer is typically yes. A lot of people think of a joint like a tire. The more you use it, the faster it wears out. But the truth is actually the opposite. Unlike a tire, if you use your joint, it actually improves the function of the joint. A joint needs activity in order to stay healthy, and it actually gets worse if you don't use it. If you do too little activity, then the muscles around the joint get weak, and so do the tendons and ligaments. And that makes it so they can't protect the joint like they typically do, and it takes more effort for you to use the joint correctly. So what can exercise actually do for arthritis? Exercise is actually one of the most effective treatments that we have for arthritis. Not only can it improve the strength of the muscles around the joint, it actually improves the health of the tendons, the health of the ligaments, the health of the cartilage, and can make it so your body can better lubricate and take care of that joint. There's actually some evidence that it can decrease inflammation in the joint. And these improvements can actually occur even when there's severe arthritis on your x-ray. And most importantly, research doesn't show that low impact exercise actually makes your joint wear out faster. In fact, research suggests that it may actually slow down the progression of the arthritis. So I want to share 5 important studies about knee arthritis. The first is a Cochrane review of 100 randomized trials that showed that exercise can improve pain and function in knee arthritis. The second is a study from the British Medical Journal that covered 200 randomized controlled trials in over 15,000 patients and showed that it doesn't really matter what the exercise is. No matter which type of exercise they were doing, people got better. The third is a study from Ghent University that showed that people who exercise did not wear out their knee any faster. The fourth is another study from Copenhagen that showed that inflammation, cartilage wear did not get worse faster in people that exercised. And the fifth is the IDEA trial, which showed that if you paired weight loss with activity, that people actually improved more than doing activity alone. So what if you tried to exercise and it seemed to make your arthritic joint worse? Well, in those conditions, it depends on how much worse it makes it. What I typically see is that for some people, it's just some mild discomfort, maybe a slight amount of swelling, and it's gone by the next day. And in those cases, you're probably okay to continue exercising at that level, although you might consider dropping it down just a little bit in intensity. If it's actually making the pain much worse, or you're getting quite a bit of swelling and it's lasting for more than just overnight, then you might be doing additional damage to the knee, and you probably need to back down on the intensity or switch to a different type of exercise. So if you get that with walking, you might try cycling or swimming. If you get that with deep squats, you might try wall sits or just not going as deep in your squat. Exercise is medicine, and the amount of stress that you put on the joint determines how well it does. Some people can handle more stress on their joint, and other people can't handle as much. And the goal is to try to stress the joint to the point that it can tolerate it without getting too much. I do see people all the time who have tried to exercise and they just can't get back to any level of exercise without their joint flaring up. And in those cases, that's where we need to do something to stabilize the tissue so that it can tolerate the exercise. Typically, the tissue is just too far gone or too irritated to handle any exercise. So in those cases, we need to start with something like physical therapy or regenerative medicine like PRP or bone marrow injections, or maybe laser or shockwave. And I've seen many cases where people are able to get to where they can exercise. That's the long-term goal, where they can maintain themselves with the exercise, but they need help to get there. Now, you may have noticed that one of the things that I did not mention to help people get back to exercise is steroid injections. And why is that? It's because steroid injections actually are making the tissue worse rather than better. They do decrease pain, and for some people that can get them back to exercising for a short period of time. But they're toxic to the cells that heal up the tissue. They're toxic to cartilage, ligaments, tendons. They're not helping the tissue in the long run, and actually make it so that that tissue degrades faster. It deteriorates faster, so the joint actually gets worse in the long run. So that's why I don't recommend steroids if you're trying to get back to exercise. Osteoarthritis may change how you exercise or what exercise you're doing, but it shouldn't stop you from exercising. Your joints actually thrive on that motion. And so if arthritis is keeping you from exercising, then come and see us and see if we can get you back to motion again, get you back to doing the things that you love.